When someone says that we can merge humans with computers, it is an indication that we're transitioning into the future. The start of a revolution that is gonna cure a lot of ailments. Before this announcement, we thought it was just science fiction, but Elon Musk announced that they might have succeeded in creating a cure for late Stephen Hawking's disease, ALS or amyotrophic lateral sclerosis, and they're gonna start human trials in the next 6 months. What would be the possibilities of implanting a chip in your brain? What if it goes wrong? Keep watching this video to the very end to find out. Hello and welcome back to Elon.Musk. If you like what you're about to see, please smash that like button and make sure to hit that subscribe button and leave a comment down below saying I've subscribed, and we'll do our best to reply to your comment.
We think probably in about 6 months we should be able to have our first Neuralink in a human. As miraculous as it may sound, we're confident that it is possible to restore full body functionality to someone who has a severed spinal cord. In my opinion, would I be comfortable implanting this in someone, one of my kids or something like that? I would say we're at the point where, at least in my opinion, it would not be dangerous.
The recent news about the integration of technology and biology has gone viral, and this revolutionary project has led Elon to claim that it can bring light to the blind and cure motor functions in people who are suffering from any form of paralysis. There are a lot of factors that go against this technological advancement. Boosting the process of evolution through technology might seem like the natural course of evolution after the Industrial Revolution, but it does paint a gruesome picture in our minds. Let's look at what the company Neuralink does. Much like a prosthetic implant, which is an artificial device that replaces a missing body part, Neuralink is a company that builds something similar, but if we put it in a hierarchy, neuroprosthetic is much more complex prosthetic that will require a lot of work. Neuralink is a company that is studying neurotechnology to develop something called a brain-computer interface. These are implantable little pieces of microchips that merge both in neuroscience and in biomedical engineering to create a device that can replace defective cognitive, sensory, and/or motor modalities to restore normal functions to the human body. Neuralink was founded back in 2016, and for 6 years, the company has hired several high-profile neuroscientists and decorated individuals in the field from different universities to achieve what they call a BCI, which is short for brain-computer interface. The company has been working very hard to achieve Elon's vision, which Elon said stemmed from a science fiction concept of neural lace. In the fictional universe of the culture, a 10-novel series by Ian M. Banks. The neural lace, as Musk defines it, is a digital layer above the cortex that might not require extensive surgical insertion. Ideally, it could also get implanted through the veins or arteries. The vision he has for the company is to achieve a symbiosis with artificial intelligence in the long term. Now, symbiosis with artificial intelligence is the interaction between two different organisms living. Elon Musk believes that this technology could be something that can mitigate the existential threat to humanity. The startup company by billionaire Elon Musk aims to merge technology with human functions with the use of dedicated hardware. The Neuralink N1 chip is a wireless implant that goes into the patient or the subject's head. The chip monitors the brain's function and also allows new commands or previously unachievable use cases. These include commands like moving the cursor on the screen of your computer with your mind and allowing a superior hearing and visual aid enhancing all the sensory organs, and also healing for people who are impaired. Neuralink works on the principle of the brain using electrical signals to function. There are about 100 billion neurons in our brain forming a network that passes electric signals. These signals then travel across our body in specific patterns, instructing a person to react or respond. Sometimes, certain parts of the brain remain inactive in people who suffer from paralysis or such diseases. The N1 chip substitutes the part of the brain that carries the function. It also monitors these signal patterns for the brain, allowing the chip in the implant to record and understand the movements. These implants can then create these signals for your body to respond and react. And these implants also can fire out signals to other mechanical or electronic devices without any sort of physical contact. The N1 chip uses Bluetooth technology to transfer your brain's electrical signal to other electronic devices by just thinking about it. The N1 chip is about the size of a cent, and it can be surgically implanted in the subject's skull to achieve accuracy. Neuralink also has designed a robotic system. These robots are capable of rapidly inserting many flexible probes into the brain without causing any kind of complications, such as tissue damage and lingering issues associated with larger and more rigid probes. This highly efficient robot has an insertion head with a 14 nanometer diameter needle and can insert 6 wires per minute. But what about probes, do you ask? These probes are made up of polyamide and biocompatible material. They have a thin layer of gold or a platinum conductor. These probes have wires that contain electrodes capable of locating electrical signals in the brain. 6 wires have 192 electrodes. One of the key features of the BMI is its ability to transmit and receive information using low-power, high-frequency signals. This means that it can communicate with other devices without requiring a lot of power, and without causing any discomfort or pain to the user. Moreover, there are issues of the brain rejecting the chip to preserve its natural integrity. This was one of the main reasons why Neuralink's N1 chip wasn't FDA approved. Neuralink was using a bioglue, which was an unapproved adhesive to glue the piece of the skull, which later leaked into the brain. Despite the glue being an FDA-approved adhesive, it did cause a lot of problems. In a press release, it was revealed that the bioglue caused bleeding in the brain. There have been a lot of alleged causes of death in these animal testing procedures, which happened from the bioglue-related complications. The failure of the device itself, and suspended infections that were related to the device, these were all the trials and errors to achieve the perfect N1 chip. Most of these incidents are hidden. Back in 2019, Musk and the Neuralink company had anticipated human experiments by 2020, but it seems like they were a bit late on the deadline. It seems like they've caught up and will be able to see some working prototypes by May next year, but what does this mean? The company has stated that the BMI will be able to connect directly to a computer or other device, allowing the user to control it using their thoughts alone. This could have a huge range of applications, from controlling a computer or smartphone to operating a wheelchair or other assistive device. But the complications of this technology go far beyond just improving the lives of people with disabilities. The BMI could also be used to enhance human cognition by allowing us to access and manipulate information in new and powerful ways. For example, it could be used to improve our memory or to help us learn new skills and knowledge more quickly and easily. And of course, there are also many potential applications for this technology in the world of gaming and entertainment. Imagine being able to control a video game or virtual reality environment using only your thoughts, or being able to experience sensations and emotions that are not possible in the real world. But of course, all of this raises some important ethical and philosophical questions. For example, how will this technology impact our ability to differentiate between our thoughts and those of the computer, and how will it affect our sense of self and our relationships with others? These are difficult questions, and there's no doubt that the development of this technology will need to be carefully managed and regulated up to the point where it's commercially available. However, the potential benefits of the brain-machine interface technology are immense, and there is a possibility that it has the potential to enhance human lives in ways that are beyond comparison, like telepathy also could be possible, or integrate with Google Home to make life easier. So, what's next for Neuralink and its brain-machine interface technology? The company has stated that it plans to begin human trials of the BMI within the next 6 months, and to have the device available for commercial use within the next few years. But the main question is, will we be in full control, or is there a way for hackers to manipulate these functions to alter our behavior? I know I'm getting way ahead of myself, but then the possibilities are endless. Of course, there are many challenges and obstacles that the company will need to overcome to achieve this goal. For example, the BMI will need to be tested extensively to ensure that it's safe and effective for human trials, and of course, there will be many regulatory and ethical hurdles to overcome along the way. Neuralink has been accused of animal welfare violations, and the pressure of the deadline has rushed the testing process. Even though we never know what is going on behind the company doors, we know that it's going to enhance human lives, and it could be a method to cure anything. Do you think this will change humanity in a good or a bad way? Do you like the idea of your brain merging with an AI? Please share your thoughts in the comment section below. Thank you so much for watching, and we'll see you in the next one.